We now know that specific genes can indicate a certain risk percentage for various cancers. Family history can indeed provide valuable insights. While certain genes like BRCA1 and BRCA2 are known to increase the risk, there are cases where family patterns suggest a genetic link even without a clear identification of those responsible genes. It's important to discuss family risk factors for breast cancer, as they play a significant role in determining an individual's likelihood of developing this condition. Be aware that those can be relatives who have died or relatives who are still alive. You have to discuss this with your patients and you have to let them know what are those first, second, and third degree relatives to them. What determines if a patient's family history of breast cancer is strong is how closely they are related to relatives with breast or ovarian cancer, how many relatives they have with this type of cancer, and whether they have a first degree male relative with breast cancer, and also having an Ashkenazi Jewish heritage. Once you have gathered the appropriate family history from your patient, consider genetic testing if there is one first degree and one second degree relative with a history, two or more first degree relative with history, three or more second degree relative with history of breast cancer, as the data shows an increased risk on those patients. Additionally, you have to consider genetic testing if your patient has a first-degree relative diagnosed with breast cancer before age 40. This is based on the data that a first-degree relative diagnosed before 50 or premenopausal has an increased risk of 2.41 to 3.18 of developing breast cancer compared to the general population. Also, regarding the history of breast or ovarian cancer, if your patient has a first degree or second degree relative diagnosed with breast cancer or with ovarian cancer, you have to consider genetic testing. And remember that the patient risk decreases with increased age as relates breast cancer diagnosis. BRCA1 and BRCA2 mutations are the most common genetic contributors to breast cancer. Discuss with your patient if they are aware of a mutation of the BRCA gene in any of their relatives. In cases where time constraints may limit the extent of personal education during appointments, providing educational materials becomes an effective strategy as this can serve as a valuable resource for patients, offering them the opportunity to review information at their own pace and refer back to it when needed.
Let's briefly take a look at the application and logistics of family history in breast cancer screening. So where does all this information leave us as PCPs in screening for breast cancer? Just to go over what we've already seen, there are a handful of unique family history scenarios that lend themselves towards genetic testing. And if you're wondering whether you should be sending these tests yourself, the simple answer is, if you have the resources to do it, yes. But let's say, as with many institutions, you don't have the resources. Where can you send your patient? Well, in addition to primary care clinics, gynecology obstetrics clinics, as well as certain telehealth providers can possibly run genetic tests on their own. And another important fact to realize, genetic testing is often less utilized in the populations who need it the most. But aside from the genetic testing, and getting back to mammograms and more routine breast cancer screening, how does family history affect this? Well, the new USPSTF guideline states, first of all, that screening should be biennial, meaning every other year or every 2 years. But secondly, it notably lacks any mention of risk factors such as family history of breast cancer, making it a blanket statement that can be difficult to apply the same way from patient to patient. So in regards to breast cancer screening, remember that it does require our clinical judgment to bend the guidelines for patients at individually higher risk or in a higher risk community and population. For instance, consider yearly instead of biennial mammograms in your patient with a notable family history of breast cancer. Now let's start wrapping it up with some final take-home facts. Starting with the most important one, data seems to show that breast cancer is becoming more and more prevalent and in younger and younger women. Here are some revealing statistics on the epidemiology of breast cancer and the impressive benefit from regular mammography.